Hello, everyone. Today is Monday, April the 27th, and you have reached Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the care you trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. If you have any questions or comments, you can drop them into the comments box from whichever platform you're viewing, or you can call us at 866-466-9734, or even better, go to our website where we have lots of wonderful information. But you can send an inquiry that way, and our website is fourseasonscare.org. Please spell out the number 4, F-O-U-R, SEASONSCARE.org. And I'm delighted, as I am every week this year, to say we are so grateful to the Van Winkle Law Firm for serving as the title sponsor for this program, Ask a Care Navigator, Mondays with Maureen. The Van Winkle Law Firm is one of the most respected and well-established law firms in North Carolina, providing exceptional representation to individuals, families, and businesses in commercial, business, personal, and estate planning matters. If you want more information or to schedule a consultation, go to the website, and that is www.vwlawfirm.com. And I've just been delighted to have several of the attorneys in that law firm join us thus far this year. So thank you to each of them. Well, last week, my friend Coral Allman from Van Winkle Law joined us to talk about advance directives, the 4 forms, the 4 documents you want to have in place while you're alive, and the 5th one for upon your death. And I mentioned that I wanted to follow up with that to talk to you a little bit about a MOST form and a DNR form. And I'm going to be sharing these documents, which are specific to North Carolina, and they're different in each state. You'll see a version of these in some form or fashion in any state in the country or district or jurisdiction or territory. But these are what we use and see and work with in North Carolina. Okay? So the first one, and this is a show and tell day today. This is our Do Not Resuscitate form in North Carolina. There we go. I'll put it there. Some people call it the goldenrod. Some call it the DNR, Do Not Resuscitate. What I want you to hear from me is that this is a medical order. This is a medical order. I can't sign it. You can't sign it. This has to be completed, signed, and dated by a physician, a physician's assistant, or a nurse practitioner. And it has to be specifically on this type of paper, this specific type of goldenrod piece of paper, and it can never be a copy. Now, what does this do for you? Basically, this says that if your heart stops beating or you stop breathing, you do not want to have CPR. You do not want to have cardiopulmonary resuscitation. You do not want to be resuscitated. Let me say that again. This applies only if your heart stops beating or you've stopped breathing and you do not wish to have CPR. This form will stop medical providers or emergency medical services providers from resuscitating you, from starting artificial respiration or mechanical respirations or chest compressions in particular. This puts a stop to that. That's why there's a stop sign. Stop. Do not resuscitate. In fact, it reads, in the event of cardiac and or pulmonary arrest of the patient, efforts at cardiopulmonary resuscitation of the patient should not be initiated. This order does not affect other medically indicated and comfort care. So this only applies, and if these are your wishes, if your heart stops beating and you stop breathing. If you have a pneumonia, that doesn't stop treatment. If you have a fractured hip, that doesn't stop your treatment. If you're having surgery, doesn't stop your treatment. okay? This only applies, and you've decided it. This is your choice if your heart stops beating or you stop breathing. And it has to be on this particular piece of paper. Do not copy, do not alter. It is that specific in the state of North Carolina. And I'll come back to that in a minute. Well, there's another form that the state of North Carolina uses. I'm doing lots of show and tell today. And it's on this Pepto-Bismol pink paper. Very specific. It has to be a certain weight, stock weight paper. And it's called a MOST form in the state of North Carolina. And MOST stands for Medical Orders for Scope of Treatment. Medical Orders for Scope of Treatment. In some states, it's called a POST, Physician's Orders for Scope of Treatment. Or it started out as something called a POLST form, POLST, Physician's Orders for Life-Sustaining Treatment. It has different names and different content areas in each state, okay? And this form is in different colors in each state. So this exists elsewhere. It's just, it looks different and it has different content. So to the point of what this is in North Carolina, these are medically orders for scope of treatment in certain circumstances. And I like to call these the 5 hot button topics. You've heard me say that before. The first hot button topic is cardiopulmonary resuscitation. If the patient has no pulse or is not breathing, do you want a resuscitation attempted? Check that. If not, check do not attempt resuscitation. That DNR. We've heard that before. Do not initiate CPR. So either attempt CPR or do not attempt CPR. Pretty straightforward. We've just looked at that. Alrighty? Now, the second hot button topic, so to speak, or the second category here is called medical interventions. The patient has a pulse and or is breathing. What's the extent of interventions that you would like to see initiated on your behalf in these circumstances? The first one is the full scope of treatment. You're going to use intubation, advanced airways, interventions, mechanical ventilation, cardioversion as indicated, full medical treatment, IV fluids, etc. And also provide comfort measures. And of course, this says transfer to hospital if indicated. If those are your wishes, you check that option. The second option in this section from under medical interventions is limited additional interventions, and that's okay too. And that involves use of medical treatment, IV fluids, and cardiac monitoring as indicated. It says then do not use intubation or mechanical ventilation, specific change from the first option, and may consider use of a less invasive airway to support, such as BiPAP or CPAP. And also provide comfort measures. That goes along the way with all these options. That may also indicate transfer to hospital if indicated, and then it adds avoid intensive care. If those are your wishes for limited full-on support, so to speak, limited additional interventions, check that option. And the third option is comfort measures. So keep the person clean, warm, and dry. Use medication by any route, positioning, wound care, and other measures to relieve pain and suffering. Use oxygen, use suction, and manual treatment of airway obstruction as needed for comfort. But it also states here, do not transfer to the hospital unless comfort needs cannot be met in the current situation. Check that option. This section involves a lot of conversation and thought with you, your loved ones, and your medical providers. Okay, the whole document does, but that one really takes a bit of time as well. The third section here, the third hot button topic I call it, are antibiotics. It's called antibiotics. And believe it or not, this is of real importance to some people. The first option here is antibiotics if indicated. That's fine. The second option here is determine use or limitations of antibiotics when an infection occurs. And the third option is no antibiotics. Use other measures to relieve symptoms. And people really do feel strongly about these options. The fourth section here, or the fourth hot button topic, I like to separate these next two. The one is medically administered fluids. IV fluids if indicated. IV fluids for a defined period of time, or no IV fluids. Provide other measures to ensure comfort. That's a hot topic right there. And then the fifth hot topic, I call it's in this section, which is medically administered nutrition. The options are a feeding tube long-term if indicated. The second is feeding tube for a defined period of time. And the third option is no feeding tube. These are really amazing sections here, really provoke conversations because we all equate food and fluid equals life. But that without food and or without fluid or both, what happens then? So lots of people have conversations, good conversations about these. Talk to your healthcare providers, talk to your family, talk to your healthcare decision makers. Make sure they are clear that these are your wishes. Okay. Now, because this is a medical order, you have to indicate who it was discussed with here. And then the physician's assistant, or the nurse practitioner must sign and date this. And you sign and date it. And there's a place on back for this to be updated annually. Now, can you have a do not resuscitate and not have a most? Sure. Can you have a most and not have a do not resuscitate order? Absolutely. Let me emphasize that these documents must be on these specific types of paper and colors and weight. This has to be a certain weight paper. And a photocopy is not acceptable. So when might you want to have one of these? Well, many people I meet say, well, those are my wishes. My do not resuscitate. I don't want CPR. That's in my estate documents. And I'll say, well, show me your DNR form. Oh, but that's in my estate documents. Even though those are your wishes in the state of North Carolina, you really must have, if those are your wishes, a DNR form or a most that indicates the same. EMS, emergency medical services providers, are obligated by law to initiate CPR in the absence of one of these documents. They're obligated by law. So when they come into your home, for example, they're looking for it. And the most common place they're looking for one or both of these color forms is on the refrigerator. Or if you or your loved one are bedbound, they might be looking on it outside your bedroom door, above your bed. They're looking for these, believe me, if they walk in the door. If someone calls 911 and you're non-responsive or you're not breathing or your heart's not beating, they're looking for these. So it's important to have originals of these documents that you have in obvious places. So in fact, I encourage people to have a whole set of them, 3 or 4 originals. You cannot make photocopies. And I had a 95-year-old client teach me this years ago. She had 3 of these, 3 sets. She had a set, one of each, that she kept on her refrigerator door in her apartment in her senior community. She had another set that she kept in her purse. And she had a third set that she kept in her glove box of her car. Yes, she was 95 years old. And she kept a set of these in her glove box. I met someone last week who had a 4th copy and a 4th set. And I think she came, it went with her in like her briefcase or work bag. People feel very strongly about these. And I have many physician friends, so I don't mind teasing about this, but this is true. This is like you telling doctors what to do. Your wishes are in writing and they're documented. It's pretty powerful. And it's very portable in the state of North Carolina, if you have it. If you leave North Carolina, there's designed to be some portability, but if you're moving to another state, it's best for you to have the documents in that state. Many of the people that I work with have homes in 2 different states, particularly Florida. So I've encouraged and instructed them to work with their physicians or medical providers in the other state to have a set when they're in that state. Again, they're designed for some portability, but practical matters would do you well to have these originals here if you're in North Carolina, or the originals in whatever state you're residing half-time. It's that important. Now, I can talk about these with you, but I can't make them legal. They must be signed by a physician, a physician's assistant, or a nurse practitioner. I cannot do it for you. Now, where do you get these forms? People always ask me. You get them from your healthcare provider, your physician, your physician's assistant, or your nurse practitioner. And believe me, they should give you as many sets of these as you request. Okay, these are your wishes. In fact, those are your wishes. You want to have them documented and readily available. Wow, that's a lot. In fact, if you're part of our Four Seasons palliative care service, you can have the provider that you work with execute these forms for you. And certainly if you're part of our Four Seasons hospice service, we will be discussing your wishes through these two forms as well. If in fact you want to be a do not resuscitate or have some of these other wishes honored. It's a medical order. It can be rescinded anytime by you, but it's a way for you and your physician to capture in writing to tell the whole healthcare system what to do or not do on your behalf. So I think these are powerful tools. I want you to think about them for yourselves. And if you have these wishes in your estate documents, then pull it out. And if you want to not be resuscitated, but it's just in your estate documents, please ask your medical provider for a DNR. Okay? Wow, that's a lot to cover for just two forms. And there are many more nuances for that. And that's why I want you to talk to your medical provider or one of our palliative care providers or one of our hospice care providers, if you're under those services, to really go over what you're signing in some detail and with intentionality. Well, I hope that will help you think about another tool in your healthcare and medical toolkit to make sure that your wishes are honored. Just like your advanced directives, the 4 documents that Coral talked about last week. You want them honored in your life, and you want your last will and testament honored in your death. These are just another tool in your toolkit. Okay, well, I want you to be sure to join me next Monday, May the 4th, Star Wars Day, for a special guest, Carter Webb with the Van Winkle Law Firm. Will be joining me for another session, and he's going to talk about beneficiary designations and joint accounts, particularly if people want to function outside of a will or a trust plan, and the benefits or burdens of estate planning in that context, or maybe that's a tool. He's got lots of experience in estate planning and just a good friend. So he will join me next Monday, May the 4th, and that episode will air shortly after noon next Monday. All righty. As always, I'm so grateful that you join us. If you have any questions, call us 866-466-9734 or go to our website, which is fourseasonscare.org. And another thank you to the Van Winkle Law Firm for serving as our title sponsor. Thank you, everyone, and have a great last Monday of April. Bye-bye.